Namaskar. I'm Dr. Kumar and Friday 6:30 p.m. and I am here with all of you. তো আজকে আমি স্টার্ট করব। আমি জানি না কত লোক জানেন কি জানেন না, রিসেন্টলি one more very prominent personality from Bollywood, Shreyas Talpade. He has acted in many good feature films and very acclaimed actor, and he also underwent angioplasty. তো ওনারও angioplasty হলো কিছুদিন আগে, and we have heard about Susmita Sen, our own Dada Saurabh Ganguly, so many young talents getting angioplasties, and we have also lost likes of Raju Srivastav, KK, Satish Kaushik, and those were all untimely deaths. And one thing was common was cardiac ailment. এখানে আমি বলতে চাই, how can we prevent all this? So my first appearance last week was just an introductory appearance, and this is the I think first serious appearance on Facebook with my friends. আজকে আমি এখান থেকে শুরু করতে চাই, how we can avoid this kind of problems. It can happen to such fit personalities like Ganguly, Susmita Sen, Shreyas Talpade, who are conscious about their physical, how they look like. They should be physically fit and active. So it can happen to anyone, and that is where the point is. So no one is indispensable from cardiac diseases. So if someone claims that I eat very less, I do exercise, I am 100% kind of a follower of all the diets, lifestyle modifications which are advised, why I should not be having any cardiac problem. So this is a wrong conception. যখন 100 লোক আছে, if there are 100 people and 100 smokers are there, 100 লোক smoke করছেন, then out of 100, if 20 people have chances of having heart disease, but 100 non-smokers, still there are 2, 3 or 5 people can have heart disease. So the chances, it does increase, the chance does increase in patients who have hypertension, risk factors like smoking, who is having more of oily foods, dyslipidemia, who has a family history, but no one is immune. And that is what I want to convey. Even if we are abiding by adhering to all the diet which are being told to follow to prevent cardiac disease, it's not 100% proof. So we hope to be fit, number one, and be open for all the problems if it is coming on the way. So to start with, how to screen yourself. Suppose you feel that you don't have any risk factor, so there is no need to undergo any screening procedure, because my family history is not there for cardiac disease, I am not a smoker, I am not obese, I am perfectly fit, I don't eat much, so I should not be screening myself for any cardiac illness. And that is where these examples, they come into picture. They were also fit, and they were also enjoying their lives with best of their ability, and they're following good diet and regimens. So when to screen for a normal population, this is the message which I want to convey today. So anyone who is approaching 35 years of his age, irrespective of his risk factors, he should at least undergo an ECG, echo, blood sugar, lipid profile done. Here we can at least come to know how is his blood pressure, is he hypertensive or not, his lipids and sugars, and obviously while screening we can make out and dig some more history from the patient, which can give clue towards cardiac illnesses. Eta holo those patients who have no problem. So maybe 35 years, 40 years, even if till 40 years if you start, that is also fairly acceptable and in guidelines as well. But what about those who have known cardiac problems, who have known symptoms, like who develop chest discomfort, যার হাঁটলে বুকে ব্যথা লাগে? What about those who are very obese, who are still smoking? What about those who are hypertensive, diabetic, still smoking? Or for those patients who have family history of heart disease, someone in family died of certain cardiac illness at 40-45 years of age. What should they be doing? So there the threshold is even less. So preferably this 35-40 becomes 30-35 years. So and 20 years is the age when one should at least check his blood pressure. So blood pressure, hypertension is important because hypertension starts right at 18-20 years of age. Even essential hypertension, যার কোনো reason হয় না, যার kidney না problem থাকলেও hypertension হচ্ছে, যে আমরা out of 100 normal population we can have 35-40 hypertensive patients. This hypertension started 20 years, and if you don't detect at 20, earlier part of your life, then this undetected hypertension, if it is 5 years, 10 years, then you are very prone to have cardiac illness. আপনার হার্ট ফেলিওর হওয়ার চান্স বেশি থাকবে, ব্রেন স্ট্রোক হওয়ার বেশি চান্স থাকবে, কিডনি ফেলিওর হওয়ার বেশি চান্স থাকে। So screen yourself at 20 years for hypertension. Screen yourself at 30 years if you have family history of heart disease, if you are a smoker, if you are obese, if you have hypertension, if you have diabetes, if you have multiple risk factors. 30 years is the right time to start your screening. And what is screening? Do an ECG, echo, blood sugar, lipid profile, and general test. And also, while screening, doctor will elicit more, dig out more history. And those who are seemingly fit, like the examples which I told at the beginning, if they are fit, why they had heart problem, and many of them we lost also, like KK, Raju, we lost, and that is a big tragedy which we don't want to have, and see in future. We definitely don't want these kind of incidences. So those who feel themselves they're fit, they should not be living in false confidence, because no one is indispensable for cardiac problems, and anyone can have cardiac problem, anyone can have heart attack, and especially winter season is a little more kind of a season where more chance of heart attacks can be happening. I really don't know how many of you have seen, কিছুদিন আগে Times of India তে ছিল, 18 years old young chap had heart attack, and he underwent angioplasty. So this is the message of today's interaction with all of you. Number one, no one is indispensable. Even if you are fit, you need screening. And screen for hypertension starting at 20 years. Look for family members who are young guys who have not got themselves checked for blood pressure. Please do it. If they are more than 20 years, please do it. And if you are approaching 35-40 years, absolutely necessary to undergo cardiac screening checkups. And this way, probably, we can find out the problems earlier, and we may not end up landing in ICUs and CCUs with severe chest pain, with ST elevation, what we call heart attacks, and needing urgent angioplasty. So I will stop here, and I will appreciate if there will be questions. I will be definitely going through those and answering in my next appearance. Abhijit ji is writing, is echocardiography or TMT test sufficient test for initial heart disease? So this is a very good question. This is a basic test is echo and TMT. TMT will give you a hint towards any inducible ischemia, and you can find out the problem. But if someone has a very classical history, he can undergo a CT angiogram or a CT calcium scoring. But ECG, echo and TMT with lipid profile, they are sufficient for screening in most of the population. So I will be still getting, if we'll be getting questions, I will be going through them. And next appearance, I will be definitely answering them before I start a new kind of conversation. So today, my conversation was screening and giving the emphasis that everyone can is prone for heart illnesses, and things can go wrong for all of us, everyone. So we should not be living in overconfidence, and screen yourself and ourselves. Thank you so much, and see you next week, 6:30. I deliberately want to keep my appearance to 10 to 15 minutes max, because this is good time to give some very focused information and get some good quality questions and answer them and interact on them. Thank you so much. See you next week, 6:30 on Friday.